So what else would happen if you did decide to join the study? Your care would probably be very little different to that you'd have outside of the trial. You'll have clinical examinations, including blood tests for PSA, and be followed up at the hospital every 4 months for 2 years, every 6 months for 5 years, then annually until 10 years have passed. What is different is that we'd like you to complete questionnaires 4 times, before you join the study, a year later, then at 5 and 10 years. These have about 50 short questions that ask about your quality of life, any symptoms you're having, and how you're feeling. Most patients only need 10 to 15 minutes to complete them. There's another optional part of the Radicals trial which looks at giving hormone treatments. Your doctor or research nurse may give you more information about this at a later date if it's an appropriate option for you to consider. So let's go over your options once more. If you don't wish to join the Radicals trial, then you'll receive radiotherapy or not, according to the standard practice in your particular hospital. If, however, you feel comfortable about being randomised to either early radiotherapy or radiotherapy only if your PSA rises, then you may want to consider taking part. Using radiotherapy after surgery might reduce the risk of the cancer returning, but it does have to be weighed against the downside of extra visits for the treatment and the possibility of side effects. We cannot say that being in the study will benefit you personally, but the results will help doctors understand better what to offer future patients with prostate cancer like yours. We need around 2,500 men to join Radicals to get a clearer scientific answer to the question about radiotherapy timing. In the next section of this DVD, you can watch and listen to a question and answer session about the radiotherapy timing comparison with real patients and Dr. Chris Parker, the lead doctor involved in the Radicals trial. We hope that you found this DVD useful. Remember, you should take all the time you need to consider these options, and if you have any further questions about the study, don't hesitate to ask your doctor.